Hi, welcome to Rotemberg Plastic Surgery. I'm Dr. Baotram Tran, and this is Dr. Rotemberg.
Hi.
So we're going to talk about drainless abdominoplasty today.
Yes, and it's a normal abdominoplasty procedure, but the exception that we put internal sutures that no drain is required, so the patient is a lot more comfortable after the procedure.
Right, I think that's the most common. Everyone that we've
Complains
seen
about
that,
the drain. They
hate the drains.
Yes.
So if you have any other procedure done in the past with a drain, you know what we're talking about. It's very annoying having these little small tubes coming out that you have to take care of, and it's a source of discomfort more than anything.
Correct. And of course, we screen the candidates, and once in a while we do have a patient that is not a candidate for a drainless abdominoplasty, but it's I would say that 90% of the patients we do drainless.
So there's quite a few studies actually has published about this, but it's not a procedure that is commonly done. I guess people are not up to date in a sense, but
we do offer that procedure if you're a candidate for it.
Right.
And the procedure is done at an outpatient surgery center. It's in and out. You go home the same day, and we usually see you in the office a week later, and then following week, 2 weeks, 3 months, etc. Patients are very happy with that procedure because they don't have drains. They have a lot less pain. We usually have them wear a binder after the first week,
and then switch to the compression garment like a girdle to kind of help maintain your shape, and then it also help reduce the swelling. That's gonna help with your recovery.
Right, and also the scar. Usually we try to put in the bikini area, and it will be slightly red and raised for about 3 months, but then usually that scar fades and it becomes a fine white line. Usually the patients, we recommend that you don't do any strenuous exercise for 6 weeks after. We do tighten the muscle so you have a flat stomach.
And same thing with most procedure, no submersion in the water because until your incision heals up completely, and then just the strenuous activities. But otherwise, we encourage you pretty much day one, up and walking, moving around. Slow pace activities is recommended so that you don't get blood clots in your legs.
Right. So. And for out-of-town patients, because we do see a lot of out-of-town patients, we recommend that you arrive here in Miami the day before, and that is just to help and prevent some blood clots. We have to be well hydrated. I tell patients to drink 2 liters of water at least 1 week before surgery, and then keep drinking a lot 1 and 2 weeks after surgery. And the recovery, it's pretty good. Most patients out of town, they stay in town for at least 1 week to 10 days, and then they go back to their city. If you can stay 2 weeks here, that's perfect, but that's not necessarily required. Now with telemedicine, we're able to communicate with the patients, and we can chat with them all the time. So that helps us a lot. If they have any problems, they can call us, and we're always just one phone call away or one text message.
Right. So that's the reason why we, if there's any issue, we want to be there to help take care of it. So that's the reason why we want you to stay, obviously as long as you can, but at least for the early period, so that we can see you and make sure that you're healing appropriately before you go home to your city. So if you have any other further questions or something that we didn't cover here, feel free to call our office or email us with your inquiries, and we're happy to answer.